If someone stacks high-dose zinc for immunity or skin and later shows fatigue, pale blood counts, or odd numbness, copper may be the missing piece of the story. Copper is not a trendy energy mineral first. It is a cofactor for enzymes that move iron into usable form, protect cells from oxidative stress, and keep nerves working when absorption stays intact. That framing keeps us out of miracle lists and inside physiology.
Okay, but copper videos keep sounding like a miracle checklist: energy, beauty, brain, everything. Before anyone buys a bottle because of that vibe, what does copper actually do in the body that is solid enough to teach instead of sell? I want the enzyme jobs and the deficiency pathway, not another 6 huge benefits montage.
Copper sits inside several copper-dependent enzymes that do ordinary but essential work. Ceruloplasmin helps iron leave storage and become usable for hemoglobin. Cytochrome C oxidase supports mitochondrial energy production. Copper-zinc superoxide dismutase handles oxidative stress. Lysyl oxidase cross-links connective tissue. When copper falls, those jobs stall together rather than one cosmetic symptom appearing alone, which is why blood and energy complaints can arrive as a package. Nerve health enters because copper enzymes support myelin maintenance and neuronal energy use. So copper deficiency is not only feeling tired after a hard week. People could develop hematologic changes and neurologic symptoms in the same storyline, and those tracks do not recover on the same schedule when zinc-driven copper loss is the cause. Blood counts may rebound while numbness or gait problems still linger for months.
So if copper is that central, why do people get deficient without eating a weird low-copper diet? Is the modern pathway more about zinc drowning copper out at the absorption step than about food shortage alone? That feels like the practical question viewers actually need answered before they add another mineral.
High zinc intake upregulates intestinal metallothionein, a protein that binds copper tightly inside gut cells. Copper then gets trapped and shed with those cells instead of entering blood. That is competition at the absorption door, not a vague minerals-fighting slogan from social media. Prolonged high zinc can empty copper stores even when some copper is still present in food, which is why the zinc source has to be named, measured when possible, and stopped. A 2026 systematic review of descriptive studies gathered 37 human cases of zinc-induced hematologic toxicity spanning from the 1970s into recent years. In every patient with measured copper, serum copper was reduced. Anemia was nearly universal, often accompanied by neutropenia or leukopenia, and severe or prolonged exposure produced pancytopenia. That pattern is uncommon, underrecognized, and coherent enough to teach as a zinc-to-copper cascade.
How extreme was the zinc in those cases? Were we only talking megadoses and needle-in-haystack weirdness? Or could ordinary long supplement habits and non-pill zinc sources get someone into clinically meaningful copper loss over months rather than overnight? I need the dose and duration range, not vibes.
Sources included oral zinc supplements, zinc-containing denture adhesive creams, and even coin ingestion. Reported elemental zinc doses range from about 50 milligrams a day to more than 1,500 across weeks to years. Bone marrow often showed vacuolated hematopoietic precursors and ring sideroblasts, so clinicians frequently first labeled the picture myelodysplastic syndrome. The copper-zinc exposure history was the reversible diagnosis hiding under that look-alike. That misdiagnosis risk is the caution, not a scare headline for the thumbnail. Unexplained anemia, falling white counts, or new neurologic symptoms need diagnostic testing, including a careful zinc exposure history and copper status. Do not start copper capsules at home to fix blood numbers without a clinician reading the labs, stopping the zinc source if present, and ruling out other marrow disease.
Who is most likely to need copper attention even without megazinc? I keep seeing bariatric surgery in late deficiency lists. Does that change the baseline enough that copper monitoring belongs in structured follow-up rather than in random supplement shopping after watching a copper benefits video?
A rapid systematic review of micronutrient deficiency case reports presenting more than 2 years after bariatric surgery found copper among the recurring deficiencies, alongside vitamins A and D. Those patients need clinician-directed labs and repletion, plus adherence support after discharge from specialty clinics. For people eating mixed diets without high zinc, denture cream zinc, or malabsorption, routine copper supplements are often unnecessary, and food copper covers the ordinary need. Copper excess is also real, and the internet rarely holds both sides in one breath. Intracellular copper is tightly regulated because surplus can drive oxidative stress and a copper-dependent cell death pathway, described as cuproptosis. Wilson disease is the classic genetic overload example. Concentrated copper supplements are a different exposure than copper from food, so more is not automatically protective for energy or nerves.
If someone already takes a multinutrient and hears copper can move oxidative markers around in study secondary analyses, how should they judge whether copper status is helping a real clinical problem versus just shifting lab noise without a clear target symptom, deficiency pathway, or exposure story to track?
Judge with the clinical problem you are treating, not a benefit board. Dietary supplements are not reviewed like drugs before sale. Products can differ from study materials, and they may interact with medications or matter around surgery and chronic disease. If zinc caused the copper drop, stop the zinc source and use clinician-guided copper repletion. Blood counts often recover over weeks to months, while neurologic recovery can lag or remain incomplete, so expectations and follow-up should be honest.
So the teachable takeaway is copper enzymes first, zinc competition second, and copper supplements only when a real deficiency pathway exists, not because a video promised 6 huge benefits, and not because a copper peptide deep dive sounded adjacent to mineral repletion for anemia or nerves.